4 Oxford dons from the English department saw 3 ladies of the evening walking down the street. The first don said, "I'd call them a tintinnabulation of bells." The second said, "I'd rather call them a flourish of strumpets." "How about an essay of trollops?" offered the third. The fourth said, "Not bad, but I like an anthology of prose best."
Another encouraging use of video is to show the impaired individual tapes of him or herself doing useful things. Dick is a relatively young victim of Alzheimer's. Diagnosed at 58 and forced to give up his job as vice president of a major construction company, his major concern is that he not become a burden on his family or society. Here, Dick shares his feelings with his youngest son, Jeff.
About all I can do for any of you is to love you and be considerate of not just you, but you and Jim and Mom. And help, especially help Mom as much as I can, because I want to feel like I'm productive, like I'm pulling my weight, not.
My mom and I visited Dick in the fall of 1991, 2 years after the above video was made. One day, the 3 of us went to the San Diego Wild Animal Park. Dick loves watching the videotape of the day's outing. What makes him feel especially good, because he's being useful, is seeing himself push Bee around in the wheelchair. The old expression, "There is no time like the present," is never truer than when applied to Alzheimer patients. Since past and future tend to slip away, it is important to make the present come alive. Videos can be used to keep the patient up to date about important people, facts, and current family events. During a family gathering 2 years ago, I videotaped each of Bee's children and grandchildren telling her about their lives. When the information became dated, I used an audio edit feature on my camcorder to insert a voiceover update. That was a lot easier than rounding up the whole family again for interviews. While Bee forgets a lot of the factual information between viewings, she loves watching the video and feels connected while it's going on and in a good mood afterwards. The videotapes just described became the basis of a training video that is used with Bee to help her remember the names of important people in her life. I edited together 30-second video segments of these and 17 other relatives and friends into what I call her people identification tape. A hired college student who works with Bee several times a week plays the tape for her and asks her to identify each individual as his or her image is displayed on the screen. The student has come to know the people on the tape so that she is able to talk to Bee about them. Reminiscence therapy is a widely used technique among persons who work with older adults. Part of coming to terms with old age and the reality of death is gaining a full appreciation of the life one has lived. Photo albums are a useful tool for stimulating reminiscences, particularly if photos are grouped by theme or occasion, and each photo is clearly labeled on the front. Families with access to a video camera can use it to record special occasions and keep them alive for their memory-impaired loved ones. Old home movies can bring back the more familiar and comforting distant past for Alzheimer patients. The movies can be made easily accessible if they are transferred to videocassette, an affordable service available at many photo labs. As Alzheimer's disease progresses, some patients lose touch with who they are and where they are in time. They may cry out for long-dead parents for comfort. They may mistake their husband or wife for a paid caregiver. Periods of disorientation may be fleeting at first. When they occur, they are frightening and disturbing, both to patient and caregiver. Mellon, the woman you saw previously taking a tape-recorded quiz, began having temporary lapses in orientation about a year after that video was made. With the cooperation of Mellon and her husband, a new, reassuring video was made covering basic facts about her life history and her children. The video was constructed so that Mellon could contribute factual personal information that she still remembered.
So you lost him, you were quite young. What do you remember about your father?
He adored me. He thought I was, my folks had been married for 13 years, I think it was. And apparently, I don't know, I did never ask them that, but I assume they didn't think they could ever have a child.
The rest of the information was provided by her husband from a prepared script.
I have loved you ever since I met you at the Valentine's dance at the University of Illinois, and would continue to love you and take care of you. It is my pleasure to look after you. After all, you devoted your life to taking care of me, our 5 children, and your mother.
Since the past and future are so elusive for Alzheimer patients, it makes sense to create a present that is as entertaining and stimulating as possible. Since new information and faces are difficult for them to absorb, current TV programs may be confusing and frustrating. Customized entertainment videos can be created by editing together excerpts of familiar old-time entertainers from TV specials and reruns and old movies. I made such a video from a recent Ed Sullivan retrospective.
We'll be right back with unique novelty acts and the best of Broadway.
The same thing can be done to bring back famous newsmakers from past decades. The recent documentary on the 60s was a good source of material for such a video. What you have just seen are examples of how Alzheimer patients and other memory-impaired persons can be encouraged, informed, reassured, and entertained through especially designed videotapes. If you lack the equipment, time, or ability to make such tapes yourself, you can hire someone to do it. It's money well spent and a gift that keeps on giving. Before I leave you, I want to present Billy again, doing one of the things she does especially well, reading poetry. In this case, a poignant and humorous poem about memory loss.
Just a line to say I'm living, that I'm not among the dead, though I'm getting more forgetful and mixed up in the head. I got used to my arthritis, to my dentures I'm resigned. I can manage my bifocals, but God, I miss my mind. For sometimes I can't remember when I stand at the foot of the stairs if I must go up for something, or have I just come down from there? And before the fridge, so often my poor mind is filled with doubt. Have I just put food away, or have I come to take some out? And there's time when it's dark with my nightcap on my head. I don't know if I'm retiring or just getting out of bed. So if it's my turn to write you, there's no need to getting sore. I may think that I have written, and I don't want to be a bore. So remember, I love you, and I wish you were near. But now it's nearly mail time, so I must say goodbye, dear. Here I stand beside the mailbox with a face so very red. Instead of mailing my letter, I opened it instead.
This program was made possible through the facilities and technical assistance of Channel 10, Fort Wayne's public access channel. This is Sharon Arkin signing off.